Hi everyone, I'm Dr. Domingo and welcome to my blog. Last week we spoke about the mental implications of COVID-19, and one of the symptoms of people not coping was insomnia due to stress and anxiety. So today I'm going to speak a little bit about insomnia. So the definition of insomnia is struggling to fall asleep or to maintain sleep throughout the night, or waking up early and struggling to get back to sleep. There's three types of insomnia that you get. There's the transient type, which normally lasts up to 3 nights. There's the acute type that can last up to 4 weeks, and once it goes over 4 weeks, that's when we call it chronic insomnia. So it is important for us to get good quality sleep, because if we don't, our functioning is impaired, we'll have trouble concentrating, we'll have mood issues, and it's just not conducive. So good sleep is super important. So symptoms of insomnia are waking up feeling unrefreshed, feeling irritable during the day, feeling drowsy during the day, having difficulty concentrating. Some people can even get tension headaches. There are quite a few causes of insomnia, and I've split them up into categories. So there's psychological causes, which are stress, anxiety, depression, bipolar mood disorder, and ADHD. So they can cause insomnia. There are medical conditions that can cause insomnia as well, such as reflux, heart failure, COPD, and asthma. Those are the common ones. Then there are sleep disorders like the restless leg syndrome, which prevents people from falling asleep or remaining asleep. There's also neurological disorders like dementia that cause insomnia. And then there are stimulants like caffeine and nicotine. And then medications. So the medications are mainly medications used for chronic conditions like high blood pressure, thyroid issues, heart disease, asthma medications, pain medications, people with cancer who are on chronic pain medications, for example. Sometimes cholesterol meds can cause insomnia as well. And then for people who are acutely ill, cold and allergy medications can also cause insomnia because they have stimulants and alcohol in them. So the good news about insomnia is that it can be treated. You can actually treat it at home, and you don't always have to use medication. There's a lot that you can do at home to get into a good sleep routine and not have to rely on medication, because eventually we don't want you to have to rely on medication to sleep, because that's obviously not normal. So there are behavioral things that you can do. One of the things is stimulus control. So that's creating a sleep environment that's conducive, that promotes good sleep. So for example, your bedroom, keeping your bedroom dark, having black blackout curtains. If there are noises outside, if you live in a noisy area and that bothers you, it's good to have white noise machines or switching on a fan just to block out that noise. So just creating an environment that's comfortable for sleeping, so that when you go to your room, you know you're going to get sleep now. Cognitive therapy. Because of people being anxious that they don't sleep, they have this negative emotion when they go to their beds. So they will go to bed thinking, oh, I'm going to struggle to sleep again. So the idea behind cognitive therapy is to change your mindset and change how you feel about sleep. So instead of feeling anxious, to have positive thoughts about going to sleep. And then that can prevent struggling to sleep. Sleep restriction is also very important. So that means taking no naps during the day, because some people, we don't all need the same amount of sleep. So some people need 7 hours, some people need 8 hours, and it all depends on individual personalities. But if you, for example, nap for 3 hours during the day, you will struggle to sleep at night, because you've slept for 3 hours, you don't need that much sleep. So sometimes it's important to not take naps in order to get good sleep at night. One of the important things as well is just having good sleep hygiene. So there are things that you can do during the day to promote that, and things that you can do at night. So things you can do during the day is to consume less caffeine, less nicotine, and less alcohol. don't exercise within 3 hours of having to go to bed. And then if you need, you can keep a sleep diary. If it's a problem, it's becoming chronic, you can keep a sleep diary that you can show to your doctor if it gets to that point. And then at night, try not to eat too close to bedtime. If you go to bed at 10 and you have a huge meal at 9, you're going to be uncomfortable and you're going to have some trouble sleeping. So try not to eat too close to bedtime. Make sure that your sleep environment is nice, comfortable, it's dark. Whatever you need to fall asleep, make sure that you create that. And then use the bedroom only for sleep and sex. There shouldn't be no televisions in your bedroom, technology at all. There shouldn't be any technology at all, but that's obviously difficult nowadays. But if there's no TV in your room, that's a good thing. Make sure that you have a regular time that you go to bed and a regular time that you wake up, so that your body gets into a routine and your body is used to 10 o'clock is sleeping time, 6 o'clock is waking up time. So that way your body gets into a routine. There's also relaxation techniques that help people to sleep. So maybe meditating or doing yoga before bed, those types of things, breathing exercises, muscle relaxation, and all of those things. So there are quite a lot of things that you can do at home to prevent insomnia. The main reason why people don't tend to do these things is because we're often very, very busy. But once you form a good routine, it's hard to get out of it. So if you stick to these things, they're very simple, very easy to do. And after 2 weeks, if you do the same thing every day, you'll find that it becomes a habit. And I think that shouldn't be too hard to do. Medications, I'm not going to talk too much about medications. There are medications that can be prescribed for people to sleep. Obviously, we don't want to prescribe it for a prolonged period of time. But the most common ones are the hypnotics, the zolpidem, and all of that. So that's normally what we prescribe. Sometimes we give antihistamines as well because it makes people drowsy, so they tend to sleep. So those are some of the medications, but that's only as a last resort or in conjunction with practicing good sleep hygiene and behavioral treatment and all of that. So yeah, that is insomnia in a nutshell. Please let me know if you have any questions. Thank you for listening. Please share the vlog and please suggest if there's any topics that you want me to talk about.